Yeah.
One interesting info I get about this Lassa fever is it be highly contagious. That be the most outstanding feature of it.
Okay.
It means say I think they give you sharp within minimal contact now you get them. So it means say we for really work on the transmission. So you will reduce some. If not, Charlie, a lot of people will be recording a lot of cases. So yeah.
So still on the signs and symptoms.
Yeah.
So someone who gets in contact with this virus and gets to the period where it's time for showing the signs and symptoms. You know, say even the World Health Organization
and the incubation period.
Then so that be the incubation period day.
When you get infected to when you show see you get infected.
But they say it be from 2 days to 21 days.
Exactly.
So the fact that you get them or you come in contact with somebody who you know they show anything means say you are healthy.
3 weeks.
Give yourself some time. 2 to 21 days. If you know sure, they mean say you are good to go. Even with that, you have to get yourself checked.
So how we gonna say some bro gets Lassa fever? So
the person go start they show symptom of fever. Generally.
Not specific
fever. Say I know they feel well. My temperature they go high. That be fever for you. Subsequently, because you say the person go talk say make weak generally, he say I make weak, and this is where you might confuse it with malaria or something else. And you go see say you go start to show symptoms of sore throat. Person fit talk say in head they bash body all the bash they get chest pain, the muscle pain. So subsequently you go see say the person start the vomit. Where it the pass watery stools, diarrhea, go lose fluid anyhow. Where as it gets into the severe form, you see the person go start to bleed from some orifices like the nose, the mouth. Go start the fish shank blood. If you urinate blood, the blood will come out from everywhere. That's how serious this condition is. That's why people will have to know, and then as soon as possible. When you start seeing these signs and symptoms, visit a nearest health.
It makes you know where to go all the way there. Okay, the moment you see you know they feel fine, go hospital. Okay, don't go pharmacy, go buy medication like that. Then
if you bleed, die.
That Charlie
go bleed, die.
Condition. It means we for really look out. The way people were scared about Ebola. We should be much equally scared about this Lassa fever. Okay.
By the way, we don't want to know if somebody gets the condition where. For instance, you go hospital, what the hospital gets in place for such a person? The treatment.
Okay. So if you get these signs or something, you know they feel fine, we go hospital, we take one of our precautions as we monitor ID at toxi when our monitoring system be high. So we suspect this case, we take sample, go Nuguchi, then say we positive for Lassa fever or Lassa virus, it means you get an infection. So the quarantine process now I just don't want to talk about the treatment.
Okay.
When it comes to the treatment, we know should I get one medication where you go cure them, okay? Just like COVID. So it's more of giving support, so support therapy we call it. More of keeping you well, addressing your issues. If you lose blood, you didn't hear blood, you didn't hear fluid.
So the symptoms you show, that be what they manage.
That be what we go target and then try keep your body tested. Strong, your immune system strong. Then one medication ribavirin, it be antiviral medication. I don't know if you did a system for Ghana. As you see for GME, Ghana Medical Association, then release letter 2. Okay, see them to then know that then they educate we, then they try mobilize the availability of ribavirin in Ghana. So if it can't it has shown to improve the outcome, clinical outcome. But that one stuff if you start them early.
So maybe they'll go
first
try
5 days.
Some people
I mean if it's available they go take treats, they go take manage the case and see try to improve the clinical outcome. So that medication then you go down admission, we go spy you, then address your needs and hopefully you recover. So far we don't get recoveries. We hope to hear recoveries they come. So Charlie it means say wanna focus really for the prevention talk. It means people no go get them.
Prevention is better than cure.
Not to think of the management and all that. So how do we prevent this one thing?
So it means first and foremost, the community itself has to be hygienic.
Okay.
People.
What do you mean?
People will have to be sensitized against Lassa fever and keeping the community clean.
Okay.
So you day area where you see say it be area where if you breed mice, before try and educate people concerning the condition. Yeah, mice, rats. So see, they don't get a chance come there. So it means say they keep refuse for a longer period. Yeah.
They go come there.
They go come there.
Where the children for.
And they can't chop. And they can't chop. At the end they can't chop.
Then they Ghana we know where the rats did, the mice did, the brunos.
We know.
So we for try clean them areas, okay?
Yeah.
So not to attract
them.
So
if the thing no day there, they no go come.
They no go come.
So try to take refuse as far away from home too. Yes.
The waste disposal should be far away from home. Also helps. Yeah. What else we do?
Where you see say rat chop, let's say your food stuff you keep for your storeroom. You see say rat chop some, then means say it pee for some place where or it defecate.
Some make you no go complete the
make you no go take
dispose them. Okay, dispose them. We not say more time they throw the bee some bread way Charlie mean them where the rats go chop half. You see the bite marks for them. You make it dispose them.
This video make a kai. Then at the university.
Okay.
We go buy. We be about 4 boys. Then we do one room where we go buy bread.
Okay.
As we buy bread, where we see say mouse can do the room inside. Then we share the bread. So we talk say, hey, this mouse we see the bread to come. If you see the bread, that boy can't do.
Yeah.
So we try. We no fit kill him. Then we don't kill him. We no fit kill him. We boot.
You mean that? How many guys you
4 boys over. We no fit kill him. So we boot come out the room inside. Out boot come out where we see say before seal all loopholes. We seal everywhere.
That be one.
We take card, paper card, seal everywhere. See the mouse no go come.
Yeah.
You don't believe say the next morning it chew the cat. It can't chop the bread so
that be in house. You manage with the visitors.
Oh.
That be in house. So they are quite stubborn.
Very stubborn.
They're stubborn to eliminate.
Oh, it chew the cat. You can't chew the bread some where it come out. It don't fit you all. It chew some where it sound come out. She say
then we for look sharp. We for be quite firm. Rodenticize them since if we kill them, we for kill them. Mouse traps, right?
Yeah.
Traps
I see for some way to say if you get scatter, it will be good. The feet chase them,
okay, nice. Biological way. Okay. Yeah, so we could try then. Vaccine no day. Vaccines no day give Lassa fever. Yet, make a talk yet. So sometimes in the future if we develop one. So we know if you look at that, we have to look at ways of trying to eliminate the risk factors for harm. So even if you do these things, okay, then ensure personal hygiene, washing your hands, cooking food properly.
Very well.
Okay, let's not lose our guard.
Often, cook the food very well.
Yeah, we still keep the necessary hygienic practices. And so Charlie, that be Lassa fever. LF, it trend. So
for sure, LF.
So hope we go stay safe and we go eliminate them from our system inside.
At the end of the day, we would want to see everyone alive. We all want to be healthy and alive. That's why we brought this video your way. So try to comment if you have questions. Help us share this video, and also the information you get, share with a brother or a sister. As we always say, welcome once again to this channel. Health check. Indeed, it's always good to get yourself checked.
See you guys on the next video.
It's Benny and Richie.